Hello, and welcome to my first LinkedIn Live session. It's great to see you all here. I'm Silvia Pfeiffer, and I'm the CEO of CoView, a telehealth software company helping healthcare businesses embrace virtual care. I come to you from the biggest lockdown in Sydney history as the Delta strain sweeps through Australia, the worst strain of the COVID pandemic yet. It does seem to me like we're getting used to dealing with lockdowns, though. There's none of the panic that we saw last year. Children are just doing their second year of partial remote education, and office workers now have a home office set up with video conferencing, probably a bit like mine here. In healthcare, we're certainly observing a second wave of telehealth uptake. More GPs than ever have managed to get themselves a video camera or a mobile phone and are starting to introduce video visits with their patients. During last year's peak, 97% of telehealth by GPs was done via phone. I can't wait to see the Medicare statistics for telehealth for this month, actually, July 2021, as many more than half of Australians are in lockdown, and our healthcare professionals are coming to the conclusion that their profession has changed profoundly and probably forever. I personally believe a new era has begun in healthcare. We've watched the signs for many years, but the pandemic has put a firm stake in the ground for a digitally converted healthcare industry. Gone are the days of sick care, where most of the issues that we go to the doctor or hospital for are acute issues that the doctor was able to just fix, be that because of an injury, accident, or infection. This type of episodic care has been dominant for the 19th and to a large extent the 20th century. And we've become really good at it. In fact, so good that our life expectancy has grown by 15 years in the last 70 years. So today we'll live until 85. It's normal. But 120 years ago, and about 1900, 50 was normal. I wouldn't be alive anymore. That is enormous progress, and our children are expected to live closer to 100 years. So today's challenges in healthcare are different, very different. We are now dealing with more chronically ill patients than with acute illnesses. Despite talking about the need to adapt, we're still working essentially the same way as 50 years ago. 40% of our healthcare spending goes to hospitals, 33% to primary healthcare. Doctor visits are the main reimbursement means of receiving care. Actually, the most interesting statistic is that 17% of Australian healthcare spending by now is actually by individuals out of pocket, and it is the fastest growing type of expenditure in healthcare. Clearly, there is a gap in our healthcare system that individuals are trying to close out of their pockets. And I'm going to venture a guess and say that is related to chronic illnesses. The ever-increasing spend on wellness and fitness would support that assumption. 50% of all Australians, adult Australians, suffer from at least one chronic illness. The Australian Institute of Health and Welfare only looks at the following 10 major chronic conditions for this statistic. That's arthritis, asthma, back pain, cancer, heart disease, lung disease, diabetes, chronic kidney disease, mental health conditions, and osteoporosis. 89% of deaths in 2018 were associated with these 10 chronic diseases. It's the biggest challenge of our lives. And not to forget COVID here as well. We are particularly overseas seeing a new thing called long COVID, which is another kind of chronic illness that has basically just been introduced. Our healthcare system is not able to scale its current operation to the needs. Our hospitals cannot deal with 50% more patients in their emergency departments. And not just that, the hospital is not the right place for chronically ill patients to be. Chronically ill patients need care in their communities. They need to look after their nutrition, their fitness, and their mental health. And they need to be made responsible for their own healthiness. There simply aren't enough healthcare practitioners to maintain in-person care at the rate required. I see the future as a combined system of technology and health expertise, where the healthcare practitioners decide on the right pathways in conjunction with the individual. Yet the individual is made responsible for executing the pathway through the support of technology. And that pathway might include medication, visits to allied health providers, visits to GPs, visits to specialists, a nutrition scheme, a fitness scheme, and a support for mental health. Your phone and the internet will be important parts of managing your daily life to help you stay on the path to good health, while your care team is brought to you as and when needed through technology or in person. That's how I envisage a good future healthcare system. And today I'm here to share with you some of the trends in digital healthcare that we're observing that are already taking us to a new way of looking after our health. Telehealth is the first step on our digital transformation. So let's start there. In 2020, just our company, CoView, has delivered over 3 million telehealth consultations. Well, not us, but we've helped 3 million telehealth consultations being delivered by our healthcare practitioners. And over 60,000 such clinicians across Australia are already using CoView. The global pandemic has certainly spurred on the mass adoption of telehealth with, on our CoView end, a 4,000% of increase in telehealth sessions since December 2019. But the pandemic is really just the catalyst for telehealth adoption. Some healthcare professionals have begun adopting telehealth solutions to improve patient care, accessibility, and remote patient monitoring. The uptake of telehealth is rising, and it's no surprise because patients love telehealth. They see telehealth not as a replacement of in-person consultations, but as a different way of reaching out to their clinicians. It's about having the appropriate type of touch point with the healthcare provider. Not the most intensive one, which is in-person care, but maybe just a quick phone call just to put any kind of concerns at rest, or a video consultation that can be addressing issues that don't require physical touch. It's about getting more efficient, both for the patient and the clinician. And it's about having choice. So we've actually undertaken consumer research. We surveyed 1,000 people, and the research showed that 70% of Australians believe that all GPs should offer video telehealth. This suggests that patient demand is not being met, particularly since 41% of the same Australians actually claimed that their clinicians, their GPs, are not offering video telehealth. Now we know that there were uncertainties around the permanence of video telehealth items and the ultimate rebate value compared to in-person consults, and many things are still being worked out. But the trend is there, and consumers are very keen for telehealth uptake. Even so much so that our statistics, our questions show that 44% of Australians say they would switch GPs to one that offers video telehealth. So Australians want their GPs to offer video telehealth in addition to their standard inpatient offerings, and would actually change to a GP that offers them more choice. It's about access to care as well. 67% of respondents stated that video telehealth actually makes healthcare more accessible. And now that we finally got bandwidth and the networks, even if some of us might need to upgrade their connections, the cameras are there with high enough quality. So we're absolutely there to make this happen. And it's happening overseas, so it will happen here as well. The other side of the picture is that even executives in healthcare across the board, across even 6 countries, are picking this up. Accenture has undertaken some research across these 6 countries with 400 healthcare executives, and 66% of the healthcare executives say they will be in the cloud within the next year, and 96% within 3 years. So they're moving their technology into the cloud in preparation for being more available online. 81% of healthcare executives say the pace of digital transformation for their organization is accelerating. And 93% of healthcare executives report that their organization is innovating with an urgency and call to action this year. In Australia, Medicare has gotten on board, even if the ultimate announcement that telehealth items will be permanent is yet to come. The March budget has announced an additional 205 million of investment into telehealth services. And the government has repeatedly stated its preference for video telehealth over phone consultations in an effort to actually encourage the uptake of digital technology. They've yet to make the reimbursements permanent, but they have announced multiple times that it will happen. What we've seen was that GPs have a preference for phone telehealth, and that's probably for multiple reasons: lack of technology, lack of training, and the idea that video will actually take a while to set up and be a time waster. Interestingly enough, when they actually pick it up and have experienced it, the opinion changes radically. So this second round of COVID has given them time to be better prepared for it, and we're observing bigger uptake. I'm really curious to see the statistics in a couple of months. In allied health and specialist care, the preference for video telehealth has already been there for many years. And this is because they've had a lot longer time to adopt video telehealth, because Medicare items have existed for them before. So that area is already starting to digitally transform. Now, telehealth and video telehealth is just the beginning of the digital transformation that we're seeing. Of all the types of telehealth, video and phone are the first ones, first steps we're taking. But there are different areas, and they are not covered yet with reimbursements in Australia. So I want to actually expand our thinking a little bit here and talk about other types of telehealth that might be coming. We may be doing text chats. We may be sending SMS messages with patients. And there may still be a healthcare interaction that needs support and needs reimbursement. And beyond that, we have asynchronous telehealth, where we do store and forward telehealth, where patients might send us a photo or a document and want an email or just a message back in an analysis. This is happening very much in dermatology today. But one other big change that's coming will be remote patient monitoring. And as much as it sounds like patient monitoring in an ICU, where you're being hooked up to a big machine and your vitals are being monitored, etc., that's not the picture that this will be. It will be instead a wearable device, maybe somewhere on your wrist, in combination with your phone. It will be your phone capturing the data and transmitting it to dashboards for your clinicians to watch, potentially for yourself to watch, and to react to. It'll be a new type of healthcare that we haven't seen yet. As soon as these mobile applications will actually give you alerts and advice for what to do to improve your health, we have a new approach to medication and to prescriptions. Overseas, we're already seeing reimbursements for such applications because they're having similar effects to pharmaceuticals. That's not happened here yet, but I believe that this is something that our country will need to be facing very soon and will be needing to transact on. So, having put all of this together, in summary, our path to the future of healthcare has only just begun. Telehealth is our first step in that direction. We foresee a transition path that will end up making better use of our limited healthcare resources and improve patient outcomes, improve patient and clinician experiences, and contribute to happier, healthier lives. So now we've got a couple of minutes for questions. I don't know if I can see any of the questions here. I have one person here saying physios seem to have adopted this sort of monitoring quite readily. I am aware that physiotherapists are some of the most technical adopters in this space, actually. PhysiTrack is one of these applications that actually help very well. So it's a mobile application that patients take back home, and it has a sort of a prescription from the physio in it, certain types of exercises that you're supposed to do regularly. And these regular exercises you get reminders for. You will be tracked on it, and there's a report going to your clinicians. So this is exactly the kind of application that I'm envisaging will actually have reimbursements in the future. And that's just for one specific area in physical therapy that we're talking about here. You can imagine that actually being applied to all of the other types of chronic illnesses as well. And as you do that, you can also check in via video with your care team. I actually believe it's not just about the exercises, it's also about the frequency in which you check in with your clinicians, and which clinicians you check in with, because your GP might have sent you to a physical therapist for a certain amount of sessions, but then you're supposed to come back to your GP and talk about your progress, and if it hasn't actually done anything, maybe come up with a different pathway, a different approach. So it's about including a whole care team into this interaction. All right, what else do we have here? There are a number of questions here around live stream. It is a new technology. I'm struggling with it a little bit myself, so this is the first time doing this. I'll see if some of these issues can now, some of these questions can be brought up. So one participant says, one issue in Australia is that Medicare still won't permit initial GP appointments via telehealth. That is a very good point to make. It didn't actually used to be that way. When the pandemic hit last year and the telehealth items were made available, they were made available for every GP generally. I believe this is a situation that we are going to be moving through, and maybe this limitation will be taken away again. It is already being taken away in certain situations when, let's say, a rural situated patient will actually need a specialist GP, let's say for disability, or somebody who can speak sign language, etc. You can actually avoid that first consultation. I think there are certain limitations that have been put on that. The point about this limitation originally, and I totally understand why that limitation was put in place, is to consider that you're actually building a relationship and a continuity of care with your local GP. So if you have your local GP that you see in person, and then you see a different GP via video online, and every time you see a different GP, you build a new care incident that your local GP that's actually tracking you doesn't have insight into, that becomes a real problem. And so that's what this is about, to actually try to avoid that. So you're actually trying to use telehealth with your personal GP. It's a situation that I would watch. I believe that it might actually change again. What else do we have here? AI. Okay, here's another question. Daniel asked, AI for range of movement. CoView has done some research in this area. What's your view on that application? So yes, CoView has implemented, together with CSIRO and West Australian University, a research program to apply artificial intelligence to a video call. And what we do is we analyze the key points in the skeleton. We identify joints, and then we can calculate the range of motion around these joints. And all of this is done by analyzing the video, and doing machine learning on top of the elements that come out of that. That application, so what we've done with the CSRO was the development of that algorithm. So the algorithm can, and that algorithm has been taken through clinical validation, so we know that the results that come out are actually accurate. And that's a really great step forward, because now we can actually do what you would do in person via a video call. In person, you use a device called a goniometer, and via video, you are actually just letting the algorithm do this work. But that's not the end of it, because the algorithm itself can be applied in many different ways. And that's what we're currently working on. We actually want to put it into a video call in a way that is most useful to a practitioner. The way we've put it in as an MVP, as a first way to work with it, was quite limited, and we realized by working with clinicians that it wouldn't actually help the way that they work. So we have put a lot of effort into improving this, and let's just say, watch this space. There will be more interesting applications coming out of this. It is now 22 past 12. There will be a recording, Stephen asks. So I'm just going to leave it at that. And I believe these comments will be on LinkedIn as well. So we might actually just reply in text on LinkedIn. It's been fascinating to run this session in such a way online. I'm very happy for all of you having been here. I hope you got a little bit of insight into the way that we're thinking about the future of healthcare and the future of telehealth. Indeed, there's a final question here. What is the future of telehealth? I believe the future of telehealth will be that it is just healthcare. It will be part of what we call healthcare and will be a normal part of our expectations of how we receive care. So thank you very much. Thanks everyone for joining us today. And have a great day.